Hi, my name's Richard Harvey. I'm an ENT surgeon in Sydney, Australia. My practice is in nose and sinus disorders, which makes me part surgeon and also part immunologist or allergist of the upper airway. Allergic rhinitis really does have significant impacts on quality of life. Not just the nasal or conjunctival symptoms, but it impacts sleep, productivity, concentration, and actually can even be measured in large studies in the workplace on absenteeism. So I think it's very important that we ensure that we don't see allergic rhinitis as just being simply the nasal symptoms, but a disease process affecting the whole body. When it comes to allergy treatments, many of the guidelines that have come out now have really suggested that if patients are going to start allergy treatment, they should really maximise their pharmacotherapy treatment initially and then de-escalate it once they get symptom relief. I don't think as the medical professionals we should be advising patients to slowly step up to allergy control. The advice is the opposite. We should maximise someone's treatment and then de-escalate it from there. And so for many patients that means using some form of local topical corticosteroid or combination nasal spray with antihistamines or other anti-allergy medications, and then once symptom relief is achieved, then de-escalating it after this point. There are many different treatment strategies for allergic rhinitis. Allergic rhinitis is so prevalent in our community that we have to have a range of strategies for people depending on whether or not the allergy is severe, mild, intermittent or persistent. For patients who have in particularly intermittent disease, or especially when it's mild to moderate, they do very well from symptomatic treatment with pharmacotherapy, simply just to suppress the allergy. Those, however, that have severe allergy, and especially those in which it's persistent, most days of the year affected, they are patients in which probably need to have a discussion about immunomodulation or desensitization treatment. And these two treatments are not one or the other or separate interventions. They just represent different strategies on how we might manage someone with allergic disease, and they're often combined in many patients. One to bring about a short-term effect and symptom relief, and another to bring about a long-term conversion or modulation of the immune response.